Sudah saya jadikan host ya, Pak. Halo.
Sebentar. Saya lagi
Oh, oke.
Oke, bisa dengar. Saya coba share screen resume ya. Oke, kelihatan kan?
Kelihatan?
Sekarang Bu Dokter Ika-nya sudah join, Dok. Belum? Kita buka setelah Bu Dokter Ika join. Dan saya kasih tahu dia.
Oke.
Oke, ini sudah oke. Kalau mau makan lagi, langsung.
Ini saya share screen lagu dulu atau gimana?
Oh iyalah. Sebentar, saya tunggu Dokter Ika ya.
Oke.
Hari ini dia katanya mau join. Ini dia. Halo, Dok.
Selamat siang, Pak Adi.
Siang, Dok. Di kampus, Dok?
Kampus, tapi tadi pagi kan saya kuliah nih, jadi
Ya.
Kayaknya
Nggak
agak-agak...
beres ya. Jadi ceritanya saya juga sempat bermasalah, Dok. Saya tanya SIM. Ternyata yang kalau pagi itu sebelum jam 12 siang, itu masalahnya bukan di internetnya Ubaya, tapi di Singapurnya yang katanya full.
Oh gitu.
Itu katanya. Nah, makanya yang kalau ada video-videonya katanya SIM sih lebih aman diselenggarakan setelah jam 1 gitu sih.
Untung saya tuh kemarin mikir mau saya pakein video ya, tapi udahlah nggak usah.
Kalau setelah jam 1 aman dong. Kalau yang sebelum jam 1-nya itu yang katanya di Singapurnya yang full gitu katanya.
Oke. Ini ada berapa banyak? Ya saya mau coba share.
Ya, share screen. Yang daftar sih 150, tapi yang biasa ikut sih sekitar 90-an sih, Dok.
Oke. Udah cukup gede kok, Pak.
Iya, lumayan.
Kelihatan ya, Pak Adi?
Oke, sip.
Sip.
Oke, sekarang tak setel lagu, dokter bisa live. Bukan live sih, maksudnya off cam dulu. Nanti jam 1 ya, jam 1 kurang sedikit, balik lagi ya, Dok ya.
Oke, makasih Pak Adi.
Thank you, Dok.
Bentar ya, yuk.
Ya. Hello, good afternoon, everyone. How are you?
Good
Afternoon,
afternoon, Pak
Pak
Adi.
Adi.
Fully ready for the next session? Okay, this afternoon we will have another interesting session where I already invite an expert from the Faculty of Medicine of the Ubaya. Wait, I need to turn off my, okay. Dr. Risma Ikawati, how are you, doctor?
I'm fine. I'm doing fine. How are you, Pak Adi?
I'm fine, we are all fine.
I hope everyone's
And
fine. Yeah.
yeah, hopefully everyone is fine up to now. And later she will share us about what some key success or some key points of how our Indonesian government flattens the number of COVID-19 cases from around 55,000 back in July only around 500 today or in November. And then, yeah, you can freely ask, as usual, you can freely ask any questions about that topic. And then, because I said it is interesting because I read in the newspaper that some countries are curious how our government is able to do it. Then Dr. Risma Ikawati will reveal how our government does it. Before I give the time for Dr. Risma Ikawati, please allow me to inform you her brief resume. Can you read mine? Right? So this is her brief resume. Dr. Risma Ikawati, PhD. So she is also a medical doctor, right, doctor? Dr. Risma Ikawati graduated as a medical doctor from University of Hasanuddin and soon after joined the research group of pharmacogenetic and hepatitic at Eichmann Institute for Molecular Biology in Jakarta. So soon after she graduated, then she joined this research group. She awarded a scholarship from Utrecht University in the Netherlands. So she got her doctoral degree from Utrecht University in the Netherlands. And her PhD was in molecular microbiology. The research subject was about methicillin-resistant Staphylococcus aureus within the Staph aureus group at Microbiology Department, University Medical Center of Utrecht University. After finishing her PhD, she worked as a postdoctoral scientist at TNO Quality of Life, the Netherlands still, for applied scientific research, says the Netherlands. She involved at the development of mini microarray for Staphylococcus aureus within the genomic group. She attended course at the Microbiology Department, Erasmus Medical Center, Rotterdam, in the Netherlands. Since 2018, she works as a lecturer at the Ubaya Faculty of Medicine, and now she is Vice Dean for Academic Affairs at the faculty. She joined professional organizations such as Indonesian Medical Association and also contributing member of American Society for Microbiology. Without further ado, now I give the time for Dr. Risma Ikawati. Please, doctor.
Yeah, thank you, Pak Adi. Hello, everyone. Very good afternoon. I hope you're all in a good shape, in a good health. And as Pak Adi already mentioned in the beginning, that I would like to share actually about the COVID pandemic in Indonesia and how we actually experience it. I think we are all experience it, and especially how Indonesia government and how we get through it. And I would like to share my presentation. Can you see my slide already?
Yes, you can see it clearly and hear your voice clearly.
Yeah, thank you. Okay, so to begin with, let me see. Yeah. So to begin my presentations, I would like to show you, this is the first slide, and perhaps most of you have seen and also heard this particular poem that has been going around in the social media. And I think this message is worth sharing. I will read some of the lines that are represent the situations we are facing right now. We are in the same storm, but not in the same boat. Your ship can be shipwrecked, and mine might not be, or vice versa. For some, quarantine is optimal, but for others, this is a desperate crisis. For others, it is facing loneliness. For some, this is peace, rest time, or even a vacation. Some have experienced the near death of the virus. Some have already lost someone from it. Some are not sure their loved ones are going to make it. And some don't even believe this is a big deal. So we are indeed going through a time when our perceptions and needs are completely different. And each one of us will emerge in our own way from that storm. We are indeed on a different ship looking to survive. So I think the first slide can represent what we are facing at the moment during the pandemic COVID-19. And I'll continue with my next slide. So if you look at the almost 2 years ago, so COVID-19 is almost having the second birthday. At the first case of COVID-19 was in China in the late December 2019. And then the virus quickly spread nationwide and only took less than 3 months to become the pandemic. And then, as we know, and as we've seen actually, the virus SARS-CoV-2 has since mutated multiple times, and with the number of variants becoming more transmissible and more deadly. But meanwhile, and unfortunately, the pandemic surveillance wasn't prepared for this outbreak. And what we've seen, there is a mortality rate which is increasing in an alarming speed. And then if you remember, or if you see at the case of the COVID-19 pandemic, it actually reminds us to the Spanish flu pandemic in 1918. It is known as the deadliest Spanish flu, or the deadliest flu in history, infected around 500 million people worldwide, or is about 1/3 of the population of Earth at that time. And the Spanish flu was killed around 20 million to 50 million people. But then, unlike today, when the 1918 Spanish flu hit, there were no vaccine, there were no effective vaccine, there is no antivirus, there is no drug to treat the flu. And we had the same problem. The hospital was so overloaded with the flu patients, and then schools, private homes, other buildings had to be converted into the makeshift hospital. And then at that time, the official or the government imposed quarantine, ordered citizens to wear masks, shut down public places, including school, church, theater. And then people were also advised to avoid shaking hands, just like what we have now, and then to stay indoors. And then public gatherings were also banned. So those who violated the policy, the rule, had to pay fine with significant sum at that time. And by the summer 1919, the flu pandemic come to an end, and those that were infected either died or developed immunity. So what we have learned actually from the Spanish flu, I think you can already find it. Which one? First is quarantine, and then physical distance or social distancing, and wearing masks, and then washing hands and surfaces. And at that time, because there is no internet like what we have now, they make fresh air and adaptive schooling, for example, open air classroom. So despite the similarities in infection spread and the public health response being very similar between the Spanish flu and also COVID-19, the thing is that these two pandemics cannot be compared because the diseases are different in how they spread, and also because the new variants make it difficult to compare. We know that the new SARS-CoV-2 variants are more transmissible, having additional variant factors and showing indication of immune escape. But then what constant is between those when the Spanish flu happens and now is the epidemiological triad. So we have the triangle, which is consists of the agent, which is the virus, and then the host, us, human, and then the environment. The interaction between these three is very important to understand how the disease can spread faster. So what we also noticed that actually human behavior is important. It is actually in the hands of human beings. So since the first outbreak, the COVID-19 pandemic has been through 3 waves with no end in sight. How are we going to deal with it? That's the question. What we learn actually is, again, I already mentioned that we learned that human behavior is part of the key factor. Yeah, and this is the chart that I want to show you that countries with number of victims exceed 100,000 deaths due to coronavirus worldwide. And as you can see here, that Indonesia is actually the top 7 on the list. Something that we are not proud of. So what we learned now that virus is here to stay. So we have to learn how to live with it, just as we live with the other infectious disease. Therefore, hard work needs to preserve public health by good hygiene, safe distancing, wearing masks, and etc. You know all the list. And our current new normal, the vaccine. We know that vaccine will help us to keep the pandemic under control, but we need to continue to live with the virus. And these are, if you see on the right side, these are the diseases, infectious disease that used to be the pandemic and then become and transform into the epidemic and stay with us up till now. What we have to do, we have to adapt to live with them side by side, alongside, and that's what we call the new normal. But the new normal apply, actually, no one size fits all. You can see in this graph that actually each country define its own new normal based on their priorities, based on their resources and also capacities. And then they decided their own preventive measures. And this data actually show how the country responds to the outbreak by taking into account all the control measures, such as social distancing, school closure, restriction on people movement, etc., including the lockdown. From this data, we can see that if you take the case in Hong Kong, for example, they applied intense surveillance with high stringency index, which is able to keep the total confirmed deaths very low. If we compare to the other approach that's applied on the other countries. So the government are taking a wide range of measure in response to COVID-19 outbreak. Various policy response around the globe can be tracked and measured using this tool actually, the stringency index. If you see at the color and also the number over here, the higher the index means that the more strict the policy applied in that country. But we have to keep in mind that there is no simple solution to the social and economic damage done by the pandemic. And therefore, different countries are still in different stages in the crisis and the circumstances response. So how about in Indonesia? How we survive the pandemic? So the expectation that the COVID-19 will become endemic in Indonesia implies that the virus will not disappear from the country. The question is, are we ready? Is Indonesia ready for the new normal? And what we've seen for the whole year in 2021, that not all cities, not all provinces actually ready at the same time. People are not ready yet to implement. At the time, we have large-scale social restriction. That's not a good start for the new normal, actually. What we need at that time, we need to educate people about how the virus behaves, how the virus transmitted, and what they should do to protect not for themselves, but also for the others, and not to transmitting the virus to other people, especially for the vulnerable groups. So this is what I mentioned earlier, that not all the provinces, not all the cities are ready. You can see there is a variation of curve. One place can be ready, one place can be ready, and the other still not there yet. So although so in around year 2000, last year, government have issued and also prolonged the large-scale social restriction that we call the SPB, large-scale social restriction, but still people cannot stick to the rule, especially around the public holiday season. We still see the large crowds pour into the malls, into the markets, although the policy have been applied. And then moreover, this is also one the contributing factors of the outbreaks, that just like any other countries, Indonesia forced to choose between the health or the economy. So in the increasing pressure to immediately reopen the economy due to the potential mass layoffs and also hunger crisis, and also the government prolonged the restriction without adequate measure at that time. And then repeated failures to act fast has also gradually increased. So this is the lesson that we can actually learn from the COVID outbreaks in India. So Indonesia actually started the vaccination program on January the 13th this year. And the government set the ambitious goal to complete the mass COVID-19 vaccine by the end of March 2020, which is covering around 180 million Indonesians eligible for vaccination. However, vaccination would cause people to drop their discipline in implementing health protocols. That could trigger a spike in case like what happened here in India. What I wrote here that people are already euphoric about the vaccination. They don't stay alert. And this is what happened in June 2021. We are facing devastating second wave of the COVID-19 outbreak. And this could occur due to first, increase in the number of a new variant with faster transmission. We heard about the Delta virus and other variants. And then the second one, the community feels that the case has dropped back to normal because between March to before June, it looks that the curve looks flattened. But then people forgot about the health protocol and then the case is going up. And then the third one is false sense of security from the vaccination. So Indonesia has suffered again through one of the worst COVID-19 outbreaks, not only in Asia, but also in the world. By early August, around 50,000 deaths in a few weeks, with total number of infections reached millions. And Indonesia in August became one of the world epicenters of the virus. And then, of course, as you can expect it, that the country was struggling to find enough oxygen, hospital beds, and other necessity for the COVID-19 patient. The same story with the Spanish flu. Overwhelmed hospitals are filled up, yeah, and then hospitals are even telling the patient to bring their own oxygen supplies because the shortage of the oxygen supply. And then it's very quick that more than 2,000 healthcare workers have died of COVID-19, despite of most of them high percentage of healthcare workers being fully vaccinated. So we suffered from the inadequate supply, oxygen shortage, and then the hospital filled far beyond its capacity. So that's why it is very difficult to treat people properly. And then how did the outbreak spiral out of control? Maybe because of the spread of the viral Delta variant and also lack of high vaccination rates. And then this one, we underestimate the real impact due to low testing rates and also poor contact tracing. And then the government took immediate controlling community, like community mobility and also community activities in order to reduce the transmission. The government also increased testing and tracing rates all over the country in order to grasp actually what is the real picture of the COVID-19 pandemic we are facing, in order to devise the right response. The government also accelerating the formation of herd immunity by accelerating the vaccination. And this is what happened actually, since the government made a very immediate response and completely different with the first outbreak. We see the result. The COVID-19 task force reported that the Indonesian COVID daily cases on Tuesday, September 14, increased by only 4,000. And then the handling of COVID-19 in Indonesia has been praised as one of the best in the world, as the nation has successfully reduced to minus 80% in 2 weeks. So this is a really achievement, and it showed that the preventive measure and accelerating the vaccination, it works. And this is how many cases have been identified now in Indonesia. So as for November 11th, the number of confirmed COVID-19 positive has risen. So it's all actually less than 500 compared to early this year. So this is if you see the case fatality rate of COVID-19 and then compared to the other part of the world, Indonesia is okay on the first since January last year, and then it's actually decreasing. In November 2020, this year it's slightly rising, but still less than 4%. And also, this is the information about the vaccinations against COVID-19. We see that among other countries, Indonesia already reached about 47% populations have been vaccinated. So the coronavirus cases recently locked below 500 daily cases, which is in contrast to the peak few months back in June or July, where daily recorded is about 50,000 cases. But for sure, this is a great, achievement. But still, we are still in the pandemic. We still have to practice health protocols and then also preventive measures. The question, how actually Indonesia handling the COVID-19 pandemic? First, by implementation of health protocols of 5M and 3T. It used to be a 3M and a 3T, but then the 3M become 5M, which is wearing masks, washing hands, physical distancing, and then avoid a crowd and also limit mobility only when it's necessary. And then the 3T is testing and tracing, and also proper treatment. And the government also, there's also implementation of what we call PPKM, pemberlakuan pembatasan kegiatan masyarakat, or restrictions toward community activities. So this is another program that's similar to the PSBB, but this one doesn't kill the economy, except once the level 4 is enacted. So within the PPKM Darurat framework, these are the details of the mobility and activity arrangements. For example, for those essential sectors such as finance, ICT, export, apply 50% work from home and 50% work from the office. So they have to make a shift, yeah? And the capacity inside the on the place, inside the building, for example, it's supposed they have a certain rule. For example, 50% of the normal capacity. And also, for example, essential government sectors, they cannot be delayed, apply 25% work from the office, and etc. You can see. And then educational institution, for example, school, university, has to conduct online learning, just like what we are doing now. And then shopping center, they have like 50% capacity, and they also make a rule like what time they can be open and what time they should close. And then art, culture, sports, and social activities are suspended. Mass transportation, and then yeah, you can all read here. And then but still we have to apply the health protocols. It's a must. We have to use face shield and mask to cover the mouth and also nose. And also we have to, for the travelers, we must show a vaccine card, at least the first dose of the vaccine. And also not complemented, but we also have to show the PCR test result 2 days prior the departure. Yeah, and this is different lockdown measures were implemented during the course of the pandemic. So we see this is actually for the whole year. For school, for example, require closing all levels since March 16 until now. And then for workplace, require closing some sectors. It's actually mentioned on the PPKM list that I already showed you. And then this is stay at home. It's actually required not leaving home with some exception. And also, how about the borders? So in the beginning of the first wave, there is a ban arrival from all regions, and then ban arrival from some regions. So as I already mentioned earlier, that the government began the vaccination program on January the 13th. The aim is to inoculate total more than 200 million people by the end of the year 2020. And they're even aiming later in March 2021. So this is the total number that already got the dose of COVID vaccine so far. And if we assume that every person needs 2 doses, that's enough to vaccinate about 39% of the country population. Yeah. So what it's no brainers that actually immunity can be surely be obtained naturally or from vaccine, but it is actually the strict social restrictions that reduce the number of the cases. And we also have the government also obligating people to use what we call Peduli Lindungi COVID-19 surveillance. This is the app that we all have to use. Even when you are coming to Ubaya, we also use this app. This is the Peduli Lindungi COVID-19 tracing prior to entering the shopping center, transport nodes, and etc., the school, public places, in order to suppress the potential spread. This app also screen people based on their medical records, in particular vaccine record, and also to determine who have tested positive and who are already cleared from the virus. So we can monitor the risk zone and also how many people actually in the building or in some places. So we decided if you see that the place you think it's too crowded, you can decide it, well, I'm not going there, for example. And also about the government also implemented supervision for foreign travelers that are coming to Indonesia. One of the anticipatory measure is by again, it's more or less the same, carry out the PCR test and then quarantine for 8 days. And during the quarantine period, a second PCR test will be carried out after 7th day of arrival, just to make sure that the foreign travels are COVID-free. And this is actually the, again, another chart, another statistic But we have to keep in mind there is no perfect statistic to compare the outbreaks on different countries that have experienced during this pandemic. And this chart actually show several different statistics, each with their own strength and also weakness, that mark that various ways actually have been implemented in each country, and then compare in its region and in the world. This is what happened. This is what we can see from Indonesia, that the infection in Asia, the numbers of infection Indonesia compared to the countries in Asia and also Middle East is actually a decrease of around 26%. Also, if we compare to the other countries globally. And also this is the number of deaths in Indonesia compared to the other region. It's about decrease about 15 or 16%. And if you look at the on the right side, that we see in the November 13, the new infections is 359, so it's very low. And then the number of mortality, the death is about 16, so it's very, very low compared to June. And again, we cannot, but we cannot stop. Yeah, it's not our effort still have to be maintained. We have to anticipate for the third wave. We don't want it happens, but we have to be prepared. But still, again, the measurement will be the same. We have to apply the health prevention with the 5M and 3T, and also, of course, the speed up of the vaccination. And at the moment, we are dealing with the mutating new strains of COVID-19. This new variant can potentially defeat the Delta. That's why we don't put your guard down, to be honest, obviously. But then the government also needs to take extra precautions upon preventing the entry of the new variants. So what the message actually from the whole presentation is actually that the pandemic control strategies are the main key to transitioning the pandemic into a pandemic. First, we have to have a high compliance with the health protocols, with the 5M, and then good testing, tracing, and also treatment with the 3T, and a rapid boost in the vaccination coverage for all Indonesians. And what we also need is actually super speed of reaction, and also anticipation is very critical to controlling and managing the pandemic. Thank you. Thank you so much. Thank you, Pak Adi.
Thank you, Dr. Risma, for your session about how the government, Indonesian government, flattened the COVID-19 cases back in July within only 2 weeks' time. Then, yeah, you can directly ask your questions and anything related to the actions of our government, anything related to how they do it, or if you want, you can also share to us what happens in your home country, where I believe that at the moment, as Dr. Risma said, that we are on the same storm, but we are not all on the same boat. So yeah, either you can ask or you can also share what happens in your home country. As usual, you can directly ask by raise your hand and then speak, or you can type at the chat section. Either one will do. Please.
I would welcome to discuss actually, because then we can share what we are facing and what is the limitations, and then we can learn each other experience.
Yes, because we are not on the same boat. Probably from the most here from Philippines. Anyone from Philippines will start to share or to ask, or from Bangladesh. Also, we have Ruby from India. If you want to share, as Dr. Isma said, that we actually already expect the second wave of this COVID-19, same from the what happened before in India. So perhaps Ruby, you can share what happened in India at that time in July, back in July or May. How, a question from Aris Sira from Suan Sunandar University, Thailand. How the Indonesian government handling about vaccine equity? You mean this vaccine equity, you mean is who are eligible and who are not eligible with getting the vaccine, Arisira? What does your, yes, okay. Yeah.
Okay.
So, yeah.
Yeah.
Please.
Thank you, Arisara. Yeah, Arisara, right?
Yeah, Arisara.
Yeah. So basically, the for the vaccine program in Indonesia, the government split that, I think, into 4 groups. So the first one, the first group was for the healthcare workers, because they are the one who actually had to
The front liner.
the front line during the outbreak. And then the second one is for the vulnerable groups, the elderly, and the rest for the adult, and then later on will be for the kids. But the kids is not yet. I think that will be implemented somewhere in the beginning of next year. So they split it into 4 groups.
Okay, so on Friday on my session, I will talk more detail on that for separation of the vaccination vaccine receiver. Yeah. But in general, all are eligible to be vaccinated, right, group? Except for kids, because kids they need some research first in order to make sure that vaccine is safe for kids, but other social or other people besides kids are eligible in Indonesia.
Yeah, true. The group for children is actually, I think it happens also everywhere. Yeah, they're still waiting for the research, and when it's safe, then they can give it to the children.
Okay, another question from Haimon. Are there individuals who are against COVID-19 vaccination in Indonesia? If so, are there any stringent measures taken against these individuals?
It always happens everywhere, not
Everywhere.
only for the COVID-19, but also for the other vaccination. Actually, there is the pro and also the anti-vaxxers, I would say. Perhaps no no particular policy for those who actually anti-vaxxers. But the thing is, when you want to go somewhere, you have to use this app that I show you earlier, the Peduli Lindungi. That's actually one of the requirement to enter this place by showing that you already been vaccinated. So if they refuse to do that, yeah, they cannot go to that place. So that's there is no particular like a punishment for those who actually refuse to take the vaccine.
Yeah, I think if I may add, it is kind of a social punishment because they cannot go around, rather than a real punishment, explicit punishment from our government, but they have a social punishment where they cannot go around. Because once we are vaccinated, those data will be connected to the Peduli Lindungi application that Dr. Risma mentioned before. And it needs to be scanned. The barcode needs to be scanned by your application, and then if it cannot treat that you have been vaccinated, then you will be rejected.
Yeah.
You are not allowed to enter any public spaces, including malls.
So there is no, indeed, there is no like a specific punishment for those who actually refuse. But that's, you are right, Mr. Adi, this is more like a social punishment. Yeah.
Yeah. Thank you for your question, Haiman. How about in Malaysia? Is there any stringent measure from Malaysian government? I heard that Malaysian government is stricter than Indonesia, right? Or anyone? How about in India? If you may share, please, Ruby.
Yeah, hi, can you hear me?
Yes. Who is it? Yeah.
Yes, so good afternoon. To specifically say about COVID in India, to us, first, before it could attack, it was more like something happening, chaos in foreign country like that. We were not educated. I mean, we were not able to know much about it in the beginning. I'm sure pretty much everyone was confused regarding how it works and everything. So we were in the same space, and we were a little more lethargic towards the issue. But then after the first attack of corona, then that is how people started to lose their lives. That is when we got to know the seriousness, the level of importance we are supposed to take care of it. And then we started slowly giving awareness to everybody, people of because India is a very diverse country with many language, many culture and everything. So we made sure somehow everybody worked together, and be it the police or the nurse and doctors, they know, they understood their risk. And yet there are doctors who worked in the front line, and they still lost lives. We couldn't do anything. But then right now with all the vaccine, we are making sure everybody is provided with the vaccines, and everyone is getting their dose, and now it is quite better. It is just like how you said over there, ma'am, in Indonesia, it was something similar to it. We didn't have awareness, but now with from the school or college, everyone is making sure we are using the hand sanitizers, masks, and all necessary rudimentary precautions we are taking. So that's how it is now.
Yeah. And how about the new cases there in India? Is it getting better now?
Yeah, it is much better now, since we know and everyone is also vaccinated. Even if we are just open to whatever is lying ahead, even if it's the third wave, now we know much better. So we are getting ready for it. I mean, if at all, we are taking the necessary precautions that it shouldn't happen. We are taking the CPR test even for people who are traveling in and out. So hopefully it doesn't happen for anybody.
Yeah,
and
God
everything
forbid.
goes back
Yes,
down.
true.
Yeah.
Yeah.
God forbid. Yes, exactly. Thank you.
Thank you.
Thank you, Ruby.
Thank you.
Same situation with Indonesia. It is much better now. Haimon answered that in Malaysia, the same. He also has My Sejahtera, the same with Peduli Lindungi, where the application can trace and also update any vaccination updates. So I think the same.
Yeah.
How about in Philippines, guys? Philippines, Eric or Karisma or Laila or Kate? Anyone would like to share what happens in Philippines nowadays? Or yeah, from Thailand, from Sudarat Sanupam. I have a question that the situation right now in Indonesia, how many percent or how many people have been vaccinated, and what type of vaccines are used in Indonesia? Okay.
The first question is like
How many
percent?
people and percent?
Yeah, I think it's about still less than 50, but I think the government's boost the speed of the accelerating the vaccinations, and which I already mentioned that the aiming is by March 2022 is already covered all the eligible Indonesian for the vaccination. And what was the second question?
What type of vaccines are used? I think brands, right?
What type?
Brands? Yeah, what types and brands?
Okay, well, in the beginning we used the Sinovac vaccine, and now the Moderna is also coming in, and the Pfizer also used.
Okay, so
AstraZeneca, yeah, I forgot one.
AstraZeneca is the second.
Also used, yeah, the second.
Yeah. How about in Thailand? What brands are you use? Sudara, while waiting for your answer, then we have a question from Louis. Good afternoon. How does Indonesia handle and implement vaccine categories? What's your take about this one? Implement, okay.
Okay.
Vaccine categorization, how they determine it?
The thing is that in the beginning, we, as I already mentioned, that we used the Sinovac. This is because this is the program from the government. So we follow the program and what the government gives for all the Indonesian is depend on the stock, for example, and then what's coming in. But still, for example, the first jab. Sinovac, and the second one will be again, of course, the Sinovac. But then the booster, for example, for the healthcare workers, they got the Moderna, for example. So the categorizations, I think the Sinovac is still the live attenuated vaccines, and the rest is with the new technology with the mRNA vaccine. I hope that's answer your questions.
Okay, and yeah, normally as in other countries, the government always prioritize on the frontliners, like the healthcare workers, and also army and police. Yeah.
And at the moment, there is not yet for the booster implemented because we still have to fill in the gap. Yeah, we still have to complete. With the aiming of 180 millions, we still have to complete the what is it again? By the end of March 2020. So that's why we still not give the booster for the public. Yeah, only for the healthcare workers at the moment.
Okay. Yeah, I don't know in other countries whether booster is common already or not, but in Indonesia it is not legal for people besides healthcare to get any booster because our government prioritize to for the healthcare workers. Raymond, what is your opinion, Dr. Risma? What is your opinion that some people prefer certain vaccine over another? Like in my country, community, many people prefer Pfizer over Astra and Sinovac, and do different brands have different efficacy?
Well, if you look at the research, before they actually applied the vaccines to the community, we can actually maybe Haimun, can actually read the articles that every vaccines they have their different efficacy. So. For example, at that time, there is a competition between AstraZeneca and Pfizer and also Moderna. But then, what the thing is that if we so picky, at that time we cannot be picky because who got the? It's much better to actually to get the vaccine first as soon as possible. Unless the vaccine is actually now free, not free, but readily available for everyone, I think people then can just choose whatever they want to, whatever they prefer. But that's not the case right now. We still are following the program from the government. So what the vaccine actually, but sometimes when there is a one center, they make announcement there will be a vaccination in this area. They're going to mention the brand. For example, we're going to give Sinovac, and then people who actually interested to get the Sinovac, they're going to that place. And then some centers, they will mention that we're going to give, for example, AstraZeneca. So, but still, this is the government program. It's not like we are going to the shops and buying. So that's not the case. Yeah.
Okay. I think it is somehow different with the one in Singapore, right? In Singapore, I heard that you can buy Sinovac, but you can freely get Pfizer. So I think every country has different characteristic of their population. Yeah, Bu, yeah.
Yeah, but I do want to add also that it is actually different brands. They have a different efficacy. Yeah, that's already proven by the research by those company actually. Yeah.
Okay.
But I don't remember. I don't remember what percentage of the efficacy of each brand.
Okay, thank you. Thank you, Louis, for your question. Hope it answers your curiosity, Louis. Okay, someone is raising hand. Charisma, please ask. You can turn on your video if you want.
I'm sorry, my internet connection is not stable, so I can't open my video. I don't have question. I just want to share COVID-19 control measures about the Philippines in the Philippines. So here in the Philippines, we also use the tracing app or the stay safe application while we are entering malls or any establishment, just like what Dr. Risma have discussed, what you're doing in Indonesia. We also use, I don't know if other countries like Indonesia is using face shield, but here in the Philippines, aside from face mask, we are using face shields, even in but not in open places like um plazas or other places that are open. We just use it while we are entering establishments, malls, and others. Also, here we have the main public transportation, which is the jeepney. I don't know if you are aware of that.
Mhm.
Well, if you are riding a jeepney, there's a boundary between the seats of the
Oh,
passengers.
yeah.
Usually it
Mhm.
is plastic to avoid the contact
Uh-huh.
between the passengers. That's all.
Yeah, thank
Okay,
you.
thank
Thank you.
you for sharing.
Yes, thank you.
Thank you. That's also actually happens here. Yeah. Well, because this is online, yeah. I hope if you are actually on offline, you can see. Yeah, if you can visit us, and then you can see that, for example, in our canteen, yeah, for the students, we have this cross sign. You cannot sit here, and then so basically, what we maintain is the physical distancing. It applied not only basically on public space everywhere, even the what is it in a taxi, for example, between the taxi driver and the passenger, they even put the what is it, the screen,
Plastic cover.
the plastic cover, the
Yeah.
screen, so they cannot actually have like, yeah, they try to limit the transmissions. That's the point.
Okay.
Yeah, and
Well,
also
talking of
wearing, yeah,
please,
by wearing the
facial.
mask, the face shield, it also
Yeah.
happens because, for example, the medical students, because I teach the medical students, because for the medical students, it's very difficult to not to come just doing the online. They have to do some of the what is it again? The practical work. What they do, what we actually did, what we do actually, they will come in a small groups, very limited, and then the space, the physical distancing. They also have to come to the school by wearing not only the double mask at the time, also the face shield. So basically it's the preventive measurement, physical distancing, and how to limit the transmission.
Okay, but frankly, in Indonesia, facial is not really popular, right, Bu? In Indonesia,
some people, yes,
some people wear, but
some people who are very keen, very
But the double mask were most preferable and were most encouraged by our government rather than wear facial. Yeah, Bu, yeah. If I'm not mistaken. Okay. So another comment from Sudara, in Thailand, the vaccine that we are used the most are Sinovac and Astra. Well, the same. But right now they are pushing to put Pfizer to the students so that so that students can go to school again, especially like primary and high school. So, and right now Thailand are already open the border for some foreigners of tourists, and if they are vaccinated, they can enter the country without quarantine. Thank you for sharing.
Okay, I'm wondering actually, is it so? It's okay, if we are vaccinated with Sinovac and going to Thailand?
Sunandar, perhaps you may answer. If we are vaccinated with Sinovac and Astra, is that okay to enter Thailand?
Yeah, because I think they use the most. Yeah, just wondering.
I think you plan to visit Thailand, Bu.
I would love to.
I would love to too. Okay, next one while waiting for Sunandar.
Okay.
From Norman, for those who will win. For those who will win the making. Yeah, Bu, just for information that Ubaya has just launches the video making competition for our summer program participants. Then this is the question: what kind of vaccine is required to get there in your country? No specific brands.
As long as you get vaccinated.
Yeah, that's the most important.
And then don't forget before you arrive, and then download the application and put the information of the vaccine. Yeah.
We'll of course we will prepare you.
Maybe the certificate of the vaccinations, and then
no problem for that. We'll prepare you and give you some orientation before you pre-departure, before you fly to Indonesia. Because there are, that's the answer, Norman. Okay. I think so. Yeah, you can enter Thailand with any brands, the same with Indonesia. But that's what Sudarat said. From another question from Louis, I would like to ask if Indonesia has physical classes now. What strategy does Indonesian government do to implement safety measures?
Yeah, we actually implemented the hybrid. That's what we call hybrid learning. So, for example, we have a big, a group of students. For example, let's say 50 students in one 50 students. We divided those students into very small groups, and some will be coming into the school, and the rest will be following the class by online, or we call it hybrid, or we can actually make a shift. So with a different group, they will come to the campus on a different time. So that's what we are doing now in Ubaya, right, Adi?
Yes.
We're doing the hybrid learning.
Yeah. So actually, our government have allowed us to do the face-to-face teaching, but because I think most of the universities and schools are not really feel safe about that face-to-face, then we implement hybrid one, which is the combination between offline and online. Yeah, and then for the offline, then it is normally conducted in a bigger class, but with a small amount of students, small quantity of students. Of course, they need to wear a mask.
Yeah, and still with the what is it, protocol? Yeah, the protocols applied.
Okay.
Yeah.
Yeah. Probably if next year the cases is decreasing, then we will have more. Hopefully, we don't know yet. Yeah.
Hopefully, because we are actually waiting. Actually, this is almost December, the holiday season. Most
That's
of
a
the
critical
time,
point.
if you look at the history back in 2020, 2021, the spike, the outbreaks always most of the time happens after the holiday season. So normally after the holiday, we just wait 1 or 2 weeks and to see whether there is a spike or no. But I hope not this year.
Yeah.
I think we all get very tired of the pandemic exhausted. I think we all, because we are human, we are we have to be socialized with others. We have to meet people, right? By meeting online is not our nature.
Yes, hopefully, I think for the whole world, there will be no another third wave, hopefully.
Yeah, hopefully.
Okay. So, yes, Jaturam, you want to ask, please? You raise your hand.
Good afternoon.
Good afternoon, Jaturam.
Okay, I'd like to ask, I really wonder how Indonesian government managed to organize and maintain health when, like when Indonesia is a big country with thousands of islands, it's going to be really hard. Yes. I want to ask that how Indonesian government managed to organize and maintain health with thousands of islands. Yes, thousands of islands in Indonesia.
Oh, okay. Because Indonesia, we have a different province. Yeah. So it's not like centralized, decentralized. Yeah. So each province, they have their own responsibility. They have a responsibility for certain areas. So
they have their own task force, COVID-19 task force.
Yeah, and that's true. Each province, each small region, they have their own task force. But this task force is still coordinating all together.
With the headquarters, the task force of the head government in Jakarta. Yeah. So normally the task force gives some comments, and then the provincial level task force will follow and implement what is commanded by the task force in Jakarta.
And if you look at what happens daily, so they report it. Yeah, they report the case on daily basis. Yeah, so that's also for the preventive measurement as well.
Yeah, on Friday I will talk more about that. We have several levels of the task force, and then daily it is daily reported. And even during the previous, I think first or second wave, every day in the TV, we
it's
see
all
an
about
update.
numbers.
Yeah, we see an update from our government, from our task force about the daily cases. Every day, every single day in TV, but not now, not anymore.
Yeah, sometimes it feels like we just like a numbers. Yeah, every day, like it's increasing, and so.
I'll talk about that on Friday.
Yeah.
Jaturam. Okay, any more? One or two last one, if you may ask, or if not, we can conclude. Up to you guys. One or two, final one, if you want. Okay. If there are no more questions and no more opinions, then I think we can conclude, ya Bu. Thank you, Dr. Isma. I know
Thank you,
that you are
Pak
very
Adi.
busy. Okay,
Thank you, Pak
so
Adi. Thank you, everyone. I hope everyone stay healthy here
yes, stay happy as
and
Dr. Daisy
happy. Yes,
mentioned
yes.
before. Okay, guys, so I will see you tomorrow morning at 10 o'clock as usual.
Okay, thank
Okay,
you.
bye-bye.
Bye.
Thank you.
Bye.
Thank
Thank
Bye.
you.
Yes, sir.
Terima kasih.
Bye.
Terima kasih Pak
Bye.
Adi.
Sampai jumpa.
Okay.